Welcome to the C.L.A.S. training video brought to you by the Utah Department of Health, Office of Health Disparities. C.L.A.S. is an acronym that stands for Culturally and Linguistically Appropriate Service Standards. Over the next 5 chapters in this video, you will learn about CLAS standards and why they're important in mental and behavioral health settings. These segments will identify techniques that may help you and your organization better serve diverse communities in Utah through implementing CLAS standards. The following chapters will go into depth on such topics as Utah demographics, considerations for implementing CLAS in your organization, how to work with an interpreter and considerations for medical interpreters in a mental health setting. The Utah Division of Substance Abuse and Mental Health, or DSAMH, has outlined strategic initiatives to build a better mental and behavioral health system for all Utahns. Utah's prevention system follows a strategic, science-based planning process called the Strategic Prevention Framework, developed by the Substance Abuse and Mental Health Services Administration. This framework is used to ensure a culturally competent, sustainable, effective, and cost-efficient system. In line with the framework, we will be discussing culturally and linguistically appropriate service standards, otherwise known as CLAS. This strategic prevention framework was adopted by the Utah Division of Substance Abuse and Mental Health in an effort to treat individuals where they are now, in an effort to prevent more serious issues later. Sustainability and cultural competence are the main areas that hold the framework components together. A set of 15 standards developed and released by the U.S. Department of Health and Human Services, Office of Minority Health, are used to advance health equity by delivering culturally respectful and linguistically responsive health care and services. Why should CLAS standards be implemented? Individuals and organizations implementing CLAS will be better able to provide the type of care that promotes access and cultural acceptance of mental and behavioral health services. These standards improve the quality of interactions with clients whose language and culture may differ from the providers. CLAS will also help organizations and providers comply with Title VI of the Civil Rights Act of 1969. Title VI protects people of every race, color, or national origin from discrimination within programs and activities that receive federal financial assistance from HHS. Section 1557 of the Affordable Care Act prohibits discrimination of race, color, or national origin under any health program or activity. In addition, adopting CLAS will help organizations with accreditation and credentialing agencies. Institutions such as the Joint Commission and the National Committee for Quality Assurance have made great strides in implementing these types of policies, and they point to CLAS standards to help ensure quality services.